Welcome back to North of the Broad. Felicia Ferguson has joined us. She is a aesthetic nurse practitioner, has opened a business called Synergy Medical Spa. It's right here in Beaufort. We're going to talk about that in a second, but she also is nurse practitioner, works at Beaufort Memorial in ICU in the evenings. Correct. And You've had a long career in nursing and nurse practitioner work. So, but let's talk about your business that you started.
Yes.
It's a medical spa. So what does that mean?
So what that means is that we offer medical services that are typically offered by an RN or a nurse practitioner that cater to aesthetic care, which is like the skin or, weight loss, right. That kind of thing, right. As opposed to a primary care practice, which deals with internal medicine. This is more aesthetic medicine.
Aesthetic. So when I define that, I would say it's more the outside.
Exactly. I think facials and that right. kind of thing.
So why were you interested in getting into this business?
Well, actually, just as a kid growing up, I had acne that I suffered from, that so many of us suffer from. Yeah. So I'd gotten different treatments over the years and just became interested in it. And, with my background in nursing, just wanted to marry the two. And I liked, I liked being a creative in a sense, because that's how I look at it, as art. So you get to kind of create with the face. So I
love how you juxtapose your real hardcore work in the hospital, which is more of the physical, the internal, exactly. with now also the external portion of yes. someone's, well-being.
Correct.
Because it really is both. We want to be healthy inside and out.
Yeah, and I think how we, portray ourselves to the world yes. has a lot to do with how we look externally. And I think that, that affects us internally as well.
So you had your grand opening on April the 11th.
I did. It was so fun. We had a great time.
And you're located where?
I'm located at 2201 Boundary Street, which is actually behind Sea Eagle Market.
Okay, perfect. And let's talk about all the services you provide. I can list them, but let you do that.
So I'll just start with some of our more popular services, which are Botox, right. So basically it's like wrinkle or anti-wrinkle therapy, for the lines that we have in the face that occur after, having made movements over the years. Sometimes they become static lines that are etched into our skin. So I offer Botox services, which I think a lot of people are familiar with. I also offer dermal fillers. Mm-hmm. There's a couple different kinds of product, but what that does, it helps with the dynamic folds that happen in our face as we age. Right. With lines that occur from the nose to the mouth or the mouth to the chin. So we're able to offer product that actually fills in some of that to kind of decrease the appearance of those wrinkles.
And then you have other medical grade skincare. So
correct.
Like, do you do laser or dermabrasion?
I don't do any lasers, but I do have microdermabrasion. I do right. offer microneedling, which yes. as well.
Right.
And then medical grade skincare product that's able to penetrate at a deeper level as opposed to what's right. what over the counter.
All right, so I want to talk about weight loss. It's such a hot topic.
It is.
And so do you, are you positive about some, was it Mounjaro and Ozempic?
Correct.
Or, you think they're okay for you to, is it a positive way to lose weight?
Well, I think that, it's an individual-based approach, and I think right. it's an individual's choice. I think, initially it started out as a diabetic medication, and it's still used mm-hmm. in that way, but I think, the FDA has approved it for weight loss, and we are seeing great results mm-hmm. as an option for weight loss.
And so you either give yourself a shot a week, once a week.
Yes.
And then, or you could come to you and
exactly.
you could actually.
Yes.
And I guess the question, is it being covered by insurance or not?
Well, for weight loss, it's not being covered by insurance. But for diabetic yes. patients, it is.
All right. And so what else do you offer? I said hair restoration.
We talked about that. Yeah. So, in the past, I think, there were hair restoration options were limited, a hair transplant. There were some medications you can take. But I actually, it's like a newer type of treatment in which you would actually take a sample of someone's blood and wow. take the platelets from that blood and use a centrifuge and spin it. And you're able to inject that back into the scalp. And because it's so rich in platelets, it actually helps with hair growth and male pattern baldness is kind of where we're seeing that it actually helps a lot with.
Exciting. Well,
It is.
well, good luck to you,
Well,
and
thank
congratulations.
you. Thank you so
I love
much
that
for having me.
you've
Thank
taken
you.
this jump, this
Yes,
risk into
yes.
owning your own business. Love
Yes.
it so much. Thank you so much.
Thank
So
you.
nice to meet you, Felicia.
You as well.
Ferguson. And that's it for this edition of North of the Broad. Thank you all for watching, and we'll see you next time. Bye.